Hi, good time everyone. I am Dr. Hadi Miskin from Department of Cesarean Gynecology, University of Bisha and University of Jazeera. Here, this session is about nutritional anemia. It is a part of team-based learning. It is a mini lecture conducted during the activity of team-based learning. The content of this lecture is suitable for the third year's class of medical students. Around 30% of the world total population is anemic, and half of these and some 600 million people have iron deficiency anemia. Anemia refers to state in which the level of hemoglobin in the blood is below the reference range appropriate for each age and sex. Other factors including pregnancy and altitude also affect hemoglobin levels and must be taken into account when considering whether the individual is anemic or not. The clinical features of anemia reflect diminished oxygen supply of the tissues, and the nutritional anemia is caused by a lack of iron, protein, vitamin B12, and other vitamins and minerals that need for formation of hemoglobins. So, what are the symptoms of nutritional anemia? It is mainly weakness, breathing problems, rapid heartbeats, pale skins, headache, craving for eyes or gray due to lack of ions, confusions, and sores in the mouth or on the tongue. The common classification of anemia is by the size of red cells, which is reflected in full blood count as MCV, indicate like the cause. Either it is normal and the end state is normal size RBCs, or either there is defect in DNA analysis synthesis, mainly due to folate and B12 deficiency, and ended with macrosomics RBCs with increased MCV, or as there is defect in hemoglobinizations, normal DNA synthesis, but there is iron deficiency, or in case of thalassemia or sideroblastic anemia, and it is ended with microcytic RBCs. So, what are the causes of anemia? Generally, iron deficiency anemia is the most common type of anemia worldwide. Gastrointestinal history is important, looking in particular for symptoms of blood loss. Don't forget that menorrhagia is a common cause of anemia in pre-menopausal females, so women should be asked about their periods. We can categorize causes of anemia either decrease or ineffective bone marrow, or either due to normal production, but mainly there is increase in the removal of the cells. In the first categorizations, when there is decrease or ineffective bone marrow, the common causes in these categories is lack of iron, vitamin B12 or folates, or hypoplasia or myeloplasia, or invasion by malignant cells. Renal failure, anemia of the chronic disease is common. On the other hand, normal bone marrow production but increased removal of cells is repeatedly seen in blood loss, hemolysis, or hyperdysplasia. So, the clinical assessment of nutritional anemia is either dietary history should be assessed, which should be assessed for the intake of ions and folates, which may become deficient in comparison to needs, like in case of pregnancy or during period of the rapid growth. Past medical history may reveal a disease which is known to be associated with anemia, such as rheumatoid arthritis, in case of anemia, or of chronic illness, of chronic disease, or previous surgery like resection of the stomach or small bowels, which may lead to malabsorption of ions and or vitamin B12 deficiency. Also, family history and ethnic background may raise suspicion of hemolytic anemia, such as in hemoglobinopathy or hereditary spherocytosis. Pernicious anemia may also be familial. Drug history may reveal the ingestion of drugs which cause blood loss, case of aspirins or anti-inflammatory drugs, hemolysis, sulfonamides, or aplasia. Yes. When we examine patient with of nutritional anemia, the right iliac fossa mass may be detected due to underlying cecal carcinoma. Hemolytic anemia can cause jaundice. Vitamin B12 deficiency may be assessed by neurological signs, including peripheral neuropathy or dementia, while sickle cell anemia may result in leg ulcers, strokes, or future pulmonary hypertension. Anemia may be multifactorial, and the lack of specific symptoms and signs does not rule out silent pathology. When we investigate anemia or nutritional anemia, the theme for the investigation of anemia are often based on the size of the red cells, which is most accurately indicated by MCV in the full blood counts. So, investigation to different anemia of chronic disease from iron deficiency anemia can be reflected by ferritins, which will be decreased, ions, decreased total ion binding capacity will be increased, while the transferrins saturation increase and decrease, and there is increase in soluble transferrin receptors in case of iron deficiency anemia. While in case of anemia of the chronic illness, there is increase in ferritins more than the normal range, while ion and total bind capacity, total ion bind capacity, transferrins, and soluble transferrin receptors, all of them are increased remarkably. So, in iron deficiency anemia, which occur when the iron loss or physiological requirement exceeds absorptions, blood loss. This may result from the acute gastritis or colorectal malignancy, gastritis, peptic ulcer, inflammatory bowel disease, and diverticulitis, polyps, and angiodysplastic lesions, and schistosomiasis, besides chronic use of aspirin or non-steroidal anti-inflammatory drugs. In women of childbearing, menstrual loss, pregnancy, and breastfeeding contribute to iron deficiency by depleting iron stores. Very rarely, chronic hemoptysis or hematuria may cause iron deficiency. In case of malabsorptions, it contributes to iron deficiency anemia, like acholoriderius and celiac disease. Also, physiological demand at time of the rapid growth, such as low infancy, iron puberty, and pregnancy. In case of anemia of chronic disease is a common type of anemia, particularly in hospital populations. It occurs in settings of chronic infection, chronic inflammations, or neoplasia. In case of megaloblastic anemia, the result from a deficiency of vitamins B12 or folate acids, or from disturbances in folic acid metabolism. Folate is important substrates of and vitamin B12 cofactors for generation of essential amino acid methionines from monocytes. The common symptoms of anemia, it could be malaise, which is represented in 90%, while others like breathlessness and paresthesia, sore mouth, weight loss, altered skin pigmentation, impotence, poor memory, depressions, personal changes, hallucinations, and visual disturbances may be reported. The common signs is smooth tongues, angular scoliosis, skin pigmentation, and heart. The causes of folate deficiency, the common cause could be the diet, poor balance of poor intake of vegetables, malabsorptions, increase in the demand, drugs, and the common drugs here is phenytoins, which used for anticonvulsants. These are the application questions for your to enrich your knowledge. What are the common cause of anemia? A. Too little sleeps, too much sugars, too little iron in the blood, or exposure to X-ray radiation. The answer is C. Anemia is of particular concern in young children, pregnant women, older individuals. All of the above. All of the above is the correct answers. We can conclude that nutritional deficiency anemia is a common problem. It can occur when the body is not absorbing enough ions, folate, or vitamin B12 from the diet. The issue may be that diet is insufficient or underlying medical conditions or treatment is interfering with the body ability to absorb these nutrients. Thank you for interesting in this sessions, and you can contact me later for any explanation or question in the provided emails. Thank you very much.